I would like to welcome Dr. Amel Anthony, the radiologist. He's radiologist of Lissing Hospital, Kochi, and he is going to uh, tell us about the session on MRI safety. Over to you, sir.
Good evening. Am I audible?
Yes, sir, you are audible.
Yes, and my screen is seen?
It's visible, yeah.
Yeah, fine. Okay, good evening to you all, and thank you for this opportunity. Now, let us get into the subject straight away. We have always been obsessed with radiation safety. With due regards to all the speakers earlier, let me tell you, but MR safety is something which is very important. Why? Because unlike radiation safety or radiation protection, this is something which can be fatal. Of late, we have heard a lot of MR accidents that have been reported, but there are many, many more accidents or near misses which never get reported. So much so, because of the fatality of the accidents, we now have an MR safety week, which is observed in the last week of July every year, just to make us aware of that gruesome incident where a 6-year-old boy got his skull crushed within the MR gantry because of a projectile steel oxygen tank. Now, that is the sort of level of things which can happen. You can see from these images how many of the ferromagnetic objects could be thrown into the gantry, and if a patient is there, how a patient can get damaged, can get injured, and it can even be fatal. And this is just one part of the MR safety protocol. Now, just to give it in perspective, what is required is, we always talk about serious injury or death, but there are a lot of minor injuries which happen. There are a lot of near misses which may not be reported at all. And then there are minor acts which get investigated. Now, just to have an overall picture, we'll just talk about the zoning, what is an MR safety committee, the training required, what is the screening which is required, the safety considerations, the RF heating and burns, and finally the time varying gradient field and emergency situations. Now, to start off, any MR safety protocol should have what is known as zoning. Now, zoning means we have 4 zones for any MR equipment to be installed. Zone 1 is actually our reception, where patients come in. It is a free-for-all area where nothing is regulated there. But when it comes to Zone 2, now Zone 2 means the Zone 2 where a patient for MRI study is interviewed either by a qualified technician or a qualified nurse, and this area only the patient and the bystander enters. Now Zone 3 is just outside the MRI suite. Now this is an area where even the fringe fields or the gauze lines could overlap into Zone 3. So Zone 3 is a completely restricted area. Now in this restricted area, only the patient enters and only authorized persons are allowed to enter, and persons entering this area should be screened before they are allowed to enter. Now Zone 3 is just outside the MRI suite, and Zone 4 is MR equipment room, and here only the technician is allowed to enter, and under the supervision of technician, the patient is allowed to enter, and there has to be complete screening before anybody enters the Zone 4, and any other medical personnel who comes in support of this patient should also be screened completely, and under the supervision of the technician should be allowed to enter. And remember, the door to this room should always be closed, except when the patient is allowed to enter, and even when the patient is being positioned, it's ideal that the door is kept closed. So this zoning is one of the primary steps to regulate patient movement and unauthorized personal movement into MRI suite and causing damage. Now, so that's about the zone. And then there are various signages which keep telling patient why this is important, because we all know that unlike radiation, in MRI, the magnet is always on. Now, coming to MR safety, been looking into, we have radiation safety committee in various hospitals and institutions. It's time we have had an MR safety committee also, because of the various dangers which are involved, which I'll be elaborating upon later. Now, about this committee, the most important, the key person would be the MR MD or the MR medical director. who will most of the cases would be the radiologist in charge. And then we have an MR safety officer who's actually a physicist or a senior MR technologist. And then we have MR safety executives. Now, these MR safety executives are all the other technologists who are working there under. And all these three groups of people, they are the key people who will ensure that MR safety protocols are set in place. So that's a MR safety committee, which have to implement policy for smooth workflow, screening, and contrast adverse reaction, and so on, of which the key point is screening of not only the patients, but also the bystanders and also the accompanying paramedical staff. In fact, this is one area where medical staff coming from different wards carry a lot of freely mobile ferromagnetic materials in their pockets. So this becomes very important. So MR safety screening, and we all know that every MRI institution will have a long list of screening form which have to be filled, either filled by the patient themselves or a nurse or technician interviews the patient, and that entire form is filled so that no previous history is unaccounted for, no freely mobile ferromagnetic materials are on the person's body. So that is MR safety screening, which is very important. Even in emergency situations, MR safety screening is very, very important. Now, ACR recommendations are there. Even for a child, the same screening procedure should be done, and for the accompanying bystander as well. So zoning, I have already mentioned. Now coming to the dangers which are there in MRI. Now, when we talk about dangers, we are talking about three important things. One is the static field from the MR machine itself. Then we have the radio frequency pulse, which comes from the coils. And then we have a varying gradient field also. So that is about the magnet. And then we have the contrast, which we administer. That's a separate field altogether. So that will not be covering in this short talk, while we'll be talking about these three fields, how it affects the patients. Now, the key to all this MR safety is, of course, projectiles. That means free ferromagnetic objects which can act as projectiles, causing damage to the equipment and causing damage to the patient who is present. And various implants, if they are, whether they are MR conditional, that means they can be used under certain conditions, like maybe in a 1.5 Tesla MRI, or they are completely unsafe or not, because these implants can either malfunction or they can get dislodged. And RF heating usually happens from the RF coils, and contrast reaction, not an important concept, but gadolinium-based contrast can cause nephrogenic systemic fibrosis, especially in patients in renal failure. And finally, the varying gradient fields, which can cause peripheral nerve stimulation. So as I said, these are the three components: the main magnet, the gradient systems, and the RF coils. Now, when we come to magnetic fields, as shown in this picture, that is a main magnet there. You can see that the field, which is maximum at the ends of this, and any metal can be a potential projectile. So that's why diligent screening is very important to ensure that the patient or the bystander or the medical personnel who enter the MRI suite, including zone 3 and zone 4, are free of any freely mobile projectiles. So a lot of equipments have been pulled into the magnet. Now coming to implants, devices, and objects. When patient is in the scanner's bore, always avoid non-MR personnel being there, and always a handheld magnet in zone 3 can ensure that none of these objects are carried into zone 3 and zone 4. And anything which is along with the patient should be labeled as either MR safe, that is a green signal there, MR conditional, that is yellow, and MR unsafe, that means it's completely avoided, or it's completely not allowed to be taken into the MRI room. So these are all some of the signages which can be there. So a common thing which can go into the MRI suite is always a trolley. So that has to be mentioned clearly. Now you can see that this trolley is strapped to the wall with a clear warning that this trolley should not be taken into the MRI room. And even for the supporting equipments like MR ventilators, MR pressure injectors, all of them are safe to a certain distance because we know that the magnet has got the gauge lines, and there are certain gauge lines beyond which the machine should not cross. If the machine crosses even these so-called MR safe ventilators and other equipments could be pulled into the magnet. Now, whenever a patient has got implants, who will take the decision? Now, whenever a patient has got an implant, either in terms of orthopedic implant or a neural implant, so this equipment has to be checked. Now we know that there are sites called mrsafety.com where you can go through, or you can actually have a talk with the vendors, and then or you can have a talk with the concerned physician or surgeon who has installed this implant, and then only then a decision should be taken, and this decision should be conveyed or should be taken along with the approval of either the MR safety officer or the MR medical director. Now, coming to radio frequency field, we know that among the most common MR side effects or MR adverse effects, the most common are the radio frequency burns. We know that it's the same spectrum as electromagnetic spectrum, and radio frequencies are emitted, and these radio frequencies can potentially emit electrical fields within the body, and this can potentially cause damage in the form of heat. Now, just like in our mobile equipment where we use electromagnetic radiation, there is an upper limit for this radio frequency. Same thing like specific absorption rate, what is known as SAR. And this SAR is actually power absorbed per unit mass in watts per kg. And this SAR depends upon the electrical field. That means it in turn is dependent on the power of the magnet. Now, tissues with increasing conductivity and reduced density will have higher SAR, and conductivity, we know that it increases with frequency. And remember, between 1.5 and 3, definitely the specific absorption rate is high on a 3T. And the patient tolerance also depends on the patient health and airflow within the bore, and the ambient air temperature, and how much the humidity is controlled, and the clothing type of the patient, and also the body habitus. And remember, the deposition of this energy is not uniform throughout the body. And organ embedded in fat, like for example, kidney, which is completely surrounded by perinephric fat, the deposition of energy will be much higher as compared to an organ which has fat within, where the specific absorption rate would be much less. Now that's a graph which shows how organ embedded in fat and fat embedded in organ cause difference in SAR. Now we have SAR limits, just like for radiation, we have SAR limits. In fact, the present equipments have this inbuilt SAR limit beyond which the radio frequency coils, they stop functioning because the SAR limit warning comes on the equipment, and the equipment automatically, the coils are switched off. So normally, with normal thermoregulatory function, the 4 watts per kg in the body is the upper limit for SAR, and between 1.5 and 3 Tesla, the SAR increases by a factor of 4. Now, there are a lot of things which can be done. We change the patient into light gown or scrubs. We control the room temperature. As far as the physics is concerned, we reduce the flip angle. We try to reduce the slice number, and then we increase the time to repetition. So all these things can be done to reduce SAR. And the other concern is tissue heating. Now, generally, tissue heating happens when there is a greater surface area to volume ratio where efficient heat dissipation does not happen. Now, this becomes a problem whenever we have a large patient who has got a reduced surface area compared to his volume. And if the body habitus fully fills up the gantry, obviously there is obstruction to airflow through the bore, and naturally the temperature and humidity within the bore rises, and the thermal exchange from body to air decreases, further causing tissue heating. But here we are more concerned about focal tissue heating, which is a concern for every patient. Now, prevention of this focal heating is by adequate spacing between inner bore and tissues. That means the body of the patient should not be in contact with the inner bore of the magnet, for which every vendor has provided adequate pads, so that should be used lavishly in proper positioning. And we know that there is focal concentration of induced electrical fields along induced voltage pathways, especially when body parts come in contact with each other. So that can produce significant and rapid heating. Now, thermal injury, most of the times this sort of injuries happen either in medial thighs where the thighs are in contact with each other, or in fingers when they are in contact with each other, or the hand is resting on the thigh. And remember, this heating or this heat damage occurs deep to the dermal layer. We know that the nociceptors and thermoreceptors are within the dermal layer. So this heating actually occurs first deep to dermal layer and then comes to dermis. So that is the time when the patient becomes aware of this heat. Now remember, when the patient complains of this heating itself, some amount of damage has already occurred to the patient, and it's later on that the skin over the surface sloughs off. So this is one area which is a very important concern, especially when the patient is positioned into the magnet. Every technologist has to take adequate care to see to it that the proper padding is done to avoid this sort of local heating. And conscious patients can experience up to third-degree burns without knowing. Okay, so that is why, because the heat or the burning occurs deep to the dermal layer. So that is just a representation there. It occurs deep to dermis. So that's why the patient may not know it at all. And when we have loops of connectors or catheters, this again can be a cause for heating which can occur. So whenever we have such circuitry, we should ensure that unnecessary wires and leads are not placed. And wherever the patient is exposed to radio frequency, we should see to it that the wires are straightened out and capped and insulated are much safer. And finally, reflected power heating can also occur from the RF shields and various blankets which are used, or homemade aluminum foils which are used. So we have to ensure that such things are not there in the radio frequency coil field. Now, other causes of heating are electrically conductive circuits and wires, which is no more important, but definitely tattoos and body piercing can be a cause for local burns, skin staples which are there, and clothing which contains silver impregnated clothing or metallic wires. So that's why we always ensure that the patient changes into a different clothing for every MRI examination. So that is just a pictorial representation of how patients should be positioned within the gantry. You can see here that there is adequate padding between not only the gantry and the patient's body, but between the different body parts, so that body parts doesn't come into contact with each other. And this can induce electrical current there and cause heating. So that's a proper way of positioning there. Now, these are some of the examples of various types of burns which can occur. So that is a tattoo with burns. That is, again, radio frequency burns there. And burns prevention, we have already said how we can change the patient into separate clothing, avoid skin-to-skin contact, avoid contact with the inner part of the gantry, see to it that cables are routed out of the scanner, and that too in a straight line, and always the lowest are possible for that particular examination, and keep the eyes and ears always protected. Now, just a few words about the varying magnetic field. That is a gradient which we apply. Gradient also has got some adverse effects. Mainly that happens in terms of peripheral nerve stimulation or sometimes giddiness, but not a common occurrence, just like radio frequency burns. Now, finally, when we come to MR safety, just like in radiation safety, it is a team effort. Now, this is a pyramidal structure which has been proposed by Dr. Rijo Mag, who is the MR safety ambassador for Asia, Oceania Society of Radiology. Now, we have a team, the team which we have already said that includes the MR technologist, MR safety officer, and the MR MD, that's the MR medical director. And we have a mission. Mission is to reduce MR potential adverse events. And the leadership is MR safety committee at the local level and a proposed MR safety board at the national level. So the important thing is any incident which happens, whether it is minor or major, it has to be reported. And protocols have to be in position, just as I said, from the way patient is screened, from zoning, and how every patient is taken in, and how SAR can be reduced. And systems and MR environment have to be as per the standards which are prescribed. And screening is very, very essential of every patient, of every potential accompanying person, and every other medical person who enters zone 3 and zone 4. And finally, training. Now, training is an ongoing process. We know that most of the hospitals with the advent of NABH have training for safety protocols, but though fire safety and radiation safety and infection control safety are part of the curriculum, but unfortunately, many institutions are yet to implement MR safety also for the entire staff of the hospital, especially our paramedical staff and doctors when they join an institution. So training has to be continuous. And finally, as part of a safe MR safety environment in Asia by AOCR, there is a 10-point call for action which has been substituted or which has been elaborated upon. I'll just go through that. Increase education initiative. That means make people aware of the potentials of MR hazards, and continuing education and training and certification. And not only the personal, but just like radiation safety, public awareness and education should also be there so that the people know that MR machine is always on. So there is a potential for danger. And multidisciplinary collaboration with all the other clinical staff which are involved with this, and knowledge and experience sharing. That means experience wherever adverse events occur. This should be shared so that people know how this can be prevented. And quality assurance programs have to be very, very stringent, especially in terms of training, screening, zoning, and the movement of personnel in and out of zone 3 and zone 4. And practice effective communication, not only among medical personnel, but from the technologist to the personnel, from the technologist to the other medical person who accompany these patients inside. And we have to always ensure that we nurture a safety and a no blame culture, because incidents have occurred due to different reasons, but then we have to ensure that such incidents do not occur in future. And especially with the advent of interventions in MRI rooms, we have to monitor advancements in interventional procedures and to minimize the risk to the patient and to the operating personnel. And finally, establishing a national MRI safety board in addition to an MR safety committee in a particular institution is very important. And I'm glad that IRA has already proposed this an MR safety board for India. So to conclude, the key aspects of MR safety are the main magnet, the radio frequency coil, we have the radio frequency pulse, and the varying gradient. And in addition to the MR contrast we have used. And in MR safety, the most important thing is to have zoning and then screening of every personnel diligently, and continuous education to make people aware that MR has got a potential for danger. And whenever an event occurs, as mentioned by NABH, we have to go to the root cause analysis, and we have to take corrective action and preventive action so that potential fatal dangers can be avoided. Thank you.